I suddenly had a stomach pain. Oh, I cannot stand. What to do? So it is what? I never had a headache. I never had such a headache. What do you mean by this?
ऐसा
No,
दर्द
I
ऐसा
never
दर्द
had
कभी
such
नहीं
a
हुआ
headache.
ऐसा दर्द कभी नहीं हुआ
हाँ, ऐसा दर्द कभी नहीं हुआ. What do you mean by that?
पहले
ऐसा
कभी
दर्द कभी नहीं हुआ. What do you mean by this?
मतलब इतनी इंटेंसिटी का हेडेक नहीं कभी नहीं हुआ।
आप मेरी बात को मुझे से बता रहे हो. I never had this headache before. I never had such a headache. What do you mean by this? सर आप इंग्लिश का हिंदी रूपांतरण कर रहे हो. अयो रामा, it is hemorrhagic stroke. हाँ, punchline. Immediately CT scan is required. So now this pain, which was a symptom, became the part after diagnosis, a part of the disease. I never had this headache. I tell you about one small case in a small story. Recently I suddenly got a phone call from a person whose wife is a singer. She came down from the stage and she had a stroke and she had a severe headache and they were not able to rule out what to do. So they took one aceclofenac paracetamol tablet, right? And they called me. The lady is known to me. She is a case of essential hypertension but very manageable. Amlodipine 2.5 milligram. And then they called me up. The husband said little in a serious tone, what? Sir, my wife is having a severe headache. My question was, is it severe or terrible? I said, can I talk to your wife? बोला yes. सर दर्द कैसा है? बहुत दर्द हो रहा है. I said, you immediately forward to a nearby diagnostic center, move for CT scan. The moment she went for CT scan, the technician was not ready. I said, it is a stroke. Patient may die on the table. Immediately do the CT scan. Because if you take to a super specialty hospital, there will be what? Procedural timing, right? And they are 20 kilometers far from a nearby super specialty hospital. So I said, go to a diagnostic center, ask the center to give me a call. I explained the technician. I said, I am a CMS. CMS means Chief Medical. The moment I said, they forwarded the scan to the, radiologist. They typed the report and there was a stroke on the Sylvian fissure. And within first 4.5 hours, TPA was given. Like mannitol and all these things, right? So first 4.5 hours was crucial. And if that were, all these are given, mannitol, Pantop, Jofer, if these medicines are given, you save the stroke. Otherwise in next 4 hours, again there may be a second stroke, third stroke, fourth stroke. Or maybe by morning the patient will die. So that is a part of what? Acute headache. So this was a defense. If now we shifted the patient to what? ICU. I told the intensivist. They said the patient was allergic to diclofenac. I told the intensivist, Tramadol is no use to give. Sir, what to do? I said we have to use, take the Aadhaar card of the patient, give fentanyl.